Good morning, students. Today's class we will see the third part of nursing management of nursing service and education. The questions we are dealing in this session include principles of supervision, role of head nurse in supervising staff and students, orientation program, student supervision, team nursing, modular nursing, and case method. We will see one by one. The first one is principles of supervision. If vision is implies seeing, the word supervision can be read as overseeing, looking over someone's shoulder to check on them, and to also super in the sense of understanding or outstanding or special, helping someone to extend their professional skills and understanding. Both of these aspects will be relevant to varying degree in supervision depending on the context. It can be helpful to think about supervision both in terms of development. The following underlying principles are the same for all forms of supervisions, that be clear about why there is a need for supervision and who was asked for it. See, set a time frame for the supervision session. Even a few minutes of focus time can be worthwhile. Protect the time and space where possible and appropriate. Try to ensure that there will be no interruptions and there will be privacy. Ensure that there is confidentiality. This means working in a place where supervision cannot be overheard and sharing identified personal details of patients only with those who are in really need to know. Think about seating arrangement, how the chairs are arranged, who sits where, and what kind of chair conveys message about status and power. Be transparent about extent of which supervision is about development or performance. This may need to be renegotiated or stated during the session. People always must always understand clearly what is expected of them. People must have guidelines in their work. That means information, techniques enable better work, coaching, and personality improvement suggestions. Good work always should be recognized. Poor work deserves constructive criticism. People should have opportunity to show that they can accept greater responsibility. People should be encouraged to improve themselves. People should work in a safe and helpful environment. The next question is role of a head nurse in supervising staff and students. Head nurse is the person who supervises the variety of tasks rendered by them by the nursing staff in his department. Being the head, his primary responsibilities involve detailing the duties to the staff nurse, preparing work schedules, and providing ample training to those nurses under his supervision, since people lives are to be in the risk if mistakes will arise, especially in the medications given to the patients. He thoroughly evaluates the nursing staff performance, particularly on his team, as a part of job assessment. He makes sure that nursing records are accurately maintained, including those face sheets of patients being monitored in every shift changes. Head nurse oversees the nurse administering the medication to ensure all regimens are strict according to the physician's instructions as stated on the career planner. Head nurse is ultimately responsible for the quality of the work performed by the nursing staff. They evaluate work activities such as maintenance of patients' records, end of shift reports, and prescribe treatment of records. Head nurses also identify and resolve any conflicts among staff members to ensure a positive work environment is maintained. Orientation program. Nursing is a dynamic profession that is subject to rapid changes in the healthcare provision, hence the need for this in-service training program for nurses. Newly employed registered nurses require in-service training in order to update them regarding the latest developments in nursing practice. A continuous program of orientation and education related to the job helps people to keep up with the changes related to the nursing and related fields, to understand policies, philosophies, and working environment of particular organization or institutions, and to provide better nursing care to the patients. As in-service program meet both immediate and long-term needs from a planning committee or a team. While one person might carry the main responsibility for the development of implementation of a nursing orientation program, it is important that representatives from different areas are allowed to voice their suggestions and concerns. Not only this is more likely to produce ideas and concepts for orientation, but it gives each department a vested interest in the success of orientation program. Start with the basics. Hospitals and other medical facilities can be intimidating complexes to have no nurses, especially those starting their first job after recent graduation from an educational training program. To acquaint nurses to a facility, the orientation program needs to provide a tour of the facility and introduce new nurses to the key staff in different departments. During the introductions, the key staff member can provide new nurses with the overview of the area, including the service they provide, special awards they have received, or special equipment they have. Cover organization information. Nurses, doctors, and other professionals in the healthcare organizations plays a major role in the overall success or failure of an organization's goals and missions. New nurses need to be aware of the mission and goals of facility to ensure they know that they should be striving toward as a member of a healthcare team. Policies and procedures also need to be covered to educate nurses on standard practices within the facilities, such as emergency situations, disaster response, and attendance. Inform new nurses about facility communication. Each healthcare organization have its own method of communication and all. It's important that nurses know what the method of process for communication is. For some, this might be email, while large hospitals might use internal paper, newsletters, or flyer postings to spread information between departments and staff. Acquaint nurse with the job responsibility. After receiving a basic orientation about entire healthcare facility, the nurse can begin learning the specific job responsibility. The nurse supervisor or another staff member needs to provide an in-depth tour with the nurse of the specific floor or wing she is scheduled to be on. She also needs to be acquainted with the record keeping procedures in the department as well as current patients on the floor or the wing and their nursing needs. Emphasize the importance of orientation. After creating an orientation program for nurses, promotion of the program and its potential to benefit the organization needs to occur. Each department must be on the board with having its employees complete orientation rather than view it as a waste of time. Periodically review the orientation program. New nurses that go through orientation should be given opportunity to provide feedback on their experience completing the orientation program. A committee can meet, review the feedback, and determine whether or not the changes need to be made to orientation program. Student supervision. Clinical supervision of the nursing students. The clinical faculty members are essential for the success of nursing students. It is possible to learn nursing without effective clinical experiences provided in an environment that provides support and respect for the students while they learn the art and science of nursing. Purpose of clinical experience. The clinical environment is an educational environment for nursing students. While students are expected to apply knowledge, practice the skill, and demonstrate professional attitudes consistent with professional nursing practice, it must be emphasized that clinical experience is a learning or practice experience for the students, not a performance experience. Clinical experiences provide the opportunity for students to first to apply the theoretical concepts learned in the classroom, practice skills learned in the nursing laboratory in the variety of clinical situations, demonstrate skills that cannot be fully experienced in the nursing laboratory, practice communication skill with their client, their families, colleagues, and other healthcare professionals, increase problem solving and clinical decision making skill. Practice clinical organization and time management skill, including determining the clinical priorities for individual and multiple clients. Socialize professionally to clinical nursing environments of hospital and community practice setting. Socialize to profession during observational and professional activities. For clinical experience to be effective, there must be learning objectives that are clear and concise. Learning objective must be written in the manner that they clearly understood by all students. The lead instructor for the course should review clinical learning objective with the students and clinical facilities so that all members of the instructional team understand the requirement. Learning objectives that are consistent for all students in a given course regardless of clinical setting and clinical instructor. The lead instructor for the course should review clinical learning objectives of the students and clinical faculty so that all members of the instruction team are consistent with their requirements. Students in a given course talk to each other and can be confused in different clinical faculty. Respect for students as a person. For many students, clinical experience are frightening because of interaction with the real patients with the real health problem. Students should be never reprimanded as the in front of the patients or other students or staff members. Students should counsel in private when the performance is unacceptable. Clinical supervision of nursing students. Nursing students require continuous feedback regarding the performance. For students who are not meeting clinical objective or standards, clinical faculty should counsel students to promptly with a plan for the remediation. For students who are meeting or exceeding the clinical objective or standards, praise for the work should also be given an opportunities for greater learning challenges discussed. Faculty should guide and nurture the students to higher stability. Team nursing. Team nursing is based on philosophy in which a group of professional and non-professional work together to identify, plan, implement, and evaluate comprehensive client-centered care. The key concept is a group that works together toward a common goal, providing qualitative, comprehensive nursing care. Objective of team nursing include the object is to give a best possible quality of the patient care by utilizing the abilities of every member of the staff to the fullest extent and by providing close supervision of both patient care and of individual who gave it. Line of organization of team nursing. A clear line of organization structure is needed for team nursing to provide a mechanism for horizontal and vertical communication, and an organized pattern is employed. Functions of team nursing. Two important points of functioning are the head nurse must know that at all times the condition of the patient and the plan for their care and must be assured that assignments and workmanship contribute to the quality of nursing. The team leader must have a freedom to use the initiative and opportunity to nurse, supervise, teach, and incubate by the responsibility by the administrative detail. Functions of a registered nurse. The team nursing registered nurse functions as a team leader and coordinates small group, not more than 4 or 5 ancillary persons to provide care to a small group of patients. As a coordinator of the team, the registered nurse must know the condition and needs of all patients assigned to the term and plan for the individualized care for each patient. The team leader is also responsible for encouraging a cooperative environment and maintaining a clear communication among all team members. The team leader's duties include planning the care, assigning the duties, directing and assisting team members, giving direct patient care, teaching and coordinating patient activities. The team leader assigns each member specific responsibilities depending on the role. Members of the team report directly to the team leader, who then report to the charge nurse or unit manager. Communication is enhanced through the use of written patient assignment, the development of nursing care plans, and the use of regularly scheduled team conferences to discuss the patient status and formulate revisions to plan of care. However, for team nursing to succeed, the team leader must have strong clinical skills, good communication skills, delegation ability, decision making ability, and ability to create cooperative working environments. Channels of communication in term nursing include reports, work, assignment conferences, patient care conference, written nursing care plan. The greatest single distinguishing feature of a team nursing is the team conference. In general, there are three parts of the conference: report by each team member to his patients, planning for new patients and changing plans as needed for others, planning the next day's assignment. Essential that conference will be well planned, brief, and but comprehensive and interesting. Team leader is a chairperson for the conference. They offer opportunity for all personnel to evaluate patient care and solve problems for the team discussion. Advantage: high quality comprehensive care can be provided despite a relatively high proportion of ancillary staff. Each member of the team is able to participate in decision making and problem solving. Each team member is able to contribute his or her own special expertise or skills in caring for the patient. Improve patient satisfaction. Organizational decision making occurring at lower level. Cost effective system because it works with expected ratio of unlicensed to licensed person. Team nursing is an effective method of patient care delivery and be used in most inpatient and outpatient healthcare settings. Disadvantages include establishing a team concept make time, effort, and consistency of the personnel. Merely assigning people to a group does not make them as a group or a team. Unstable staffing pattern makes team nursing difficult. All personnel must have the client centered. There is a less individual responsibility and independence regarding nursing functions. Continuity of care may suffer if daily team assignments vary and patient is confronted in many different caregivers. Team leader may not have the leadership skills required to be effectively direct the team and create a team spirit. Insufficient time for the care, planning, and communication may lead to the unclear goal. Therefore, responsibilities and care may become fragmented. Next question is modular nursing. Modular nursing is a modification of team nursing and focus on patient's geographic location for the staff assignment. Patient unit is divided into modules or districts and the same team caregivers is assigned consistently to the same geographic location. Each location or module that are assigned as a team leader and the other team members may include just as the team nursing, the team leader in a modular nursing is accountable for all patient care and responsible for providing leadership for the team members and creating a cooperative work environment. The concept of modular nursing calls for smaller group of staff providing care for smaller group of patients. The goal is to increase the involvement of registered nurses in planning and coordinating the care. Communication is more efficient among the smaller group of team members. The success of the modular nursing depends greatly on leadership abilities of the team leader. Advantage: continuity of care is improved when the staff members are constantly assigned to the same module. The registered nurse as a team leader is able to be more involved in planning and coordinating the care. Geographic closeness and more efficient communication saves staff time. Disadvantages include cost may be increased to stock each module with necessary patient care supplies, medication cart, linens, and dressings. Long corridors, common in many hospitals, are not conducive for the modular nursing. Case method. Case method of delivering nursing care is simply defined, sometimes referred as total patient care. Registered nurse is responsible for the patient care and total care responsibility for the patient during the shift work. Work allocation. All patients have a registered nurse assigned to them, and this type of delivery system requires exclusively use of all registered staff. There is no assignment required that registered nurse have the same patient day after day, nor is consistent coordinated to ensure continuity of care during the course of the hospitalization. The case method is frequently practiced in the intensive care settings or in the home health settings. Clinical decision making. The RN assumes responsibility for total care of patient and may have several assigned patients. In addition to being responsible for the nursing process, the RN is responsible for all indirect and direct patient care functions. Care planning and goal setting occur between family, patient, and the nurse during the specific shift. The charge nurse may have patient load or may assist where needed. The role of the charge nurse is to manage the shift activities, provide consultation to the staff, and make patient assignments according to the resource available. Communication. RN communicate changes, needs, and requests for assistance to the charge nurse. The registered nurse is generally expected to communicate with physicians and other disciplines regarding patient care needs. Communication and coordination of care between shifts is dependent on the efforts of individual shift nurse. Advantage of the case method are considered to be holistic and comprehensive care delivered by a registered nurse. The cost of registered nurse, lack of continuity between shift, and dependence on adequate supply of nurses are considered to be a disadvantage of this system. The disadvantages to the case method of nursing care delivery can be mitigated through the use of advanced practice nurses and case managers. Advanced practice nurses typically work side by side in settings where the case method is implemented. The clinical nurse leader would serve to coordinate care between other disciplines in this delivery system care. Thank you.